Hi, good morning. This is Dr. Khalil with Mansfield Aesthetics. I'm going to do a quick video just to go over the before instructions for a SmartGraft procedure at our facility. SmartGraft is a hair transplant procedure where we use follicular unit extraction, which means individual hairs taken out of the donor site, which is on the back of the head, and then placed either to the hairline or the crown. We can also do beard and goatee, and some people even do eyebrow transplants. Some good things to keep in mind before your hair transplant is to go over your plans and your expectations with the physician. Understand how the process works and what is achievable with a hair transplant. Keep in mind that the results will be permanent, unlike other medical therapies for hair restoration. A good idea would be to bring pictures of what your hairline used to look like, or what you were going for in terms of your expectations for your hair. Learn about the process, learn about what SmartGraft is, learn about what FUE versus FUT is. Understand that hair transplant has evolved and it's no longer limited to cutting a strip out of the back of the donor site and stitching it up. We're able to do hair transplant, which is really effective, really cosmetically pleasing, and minimally invasive with a quick healing time. Essentially, when you come to do hair transplant with me, we want to make it so that no one ever knows that you had a hair transplant. Ask about extras with your doctor. Ask about if PRP is used during the transplant. That's platelet-rich plasma. Understand that when you come to our facility, we do all of our hair transplants with PRP, and that helps to enhance the healing process and speed up the recovery of the hair transplant. Everything with hair restoration surgery takes about 12 months, so keep in mind that it is a long process. But the payoff at the end of it is exponential. You'll have hair for the rest of your life. If you are a male who's suffering from male pattern hair loss, I would urge you to take finasteride and to stay on it, especially if you're considering doing a hair transplant. We wouldn't want a "I told you so" situation where the transplanted hair survives and then you lose more existing hair because you're not medically treating your hair loss with finasteride. Finasteride is a anti-DHT, anti-androgen, so it does block the negative effects of testosterone on hair loss, but it shouldn't affect the testosterone balance in your body in any negative way. Before your hair transplant, abstain from drinking alcohol because it is a blood thinner for at least 1 week. That way we can limit the amount of bleeding during your surgery. Hand in hand with that is to avoid other blood thinners like aspirin, fish oil, ibuprofen, and obviously if you're taking anything from your heart doctor like Plavix, warfarin, or anything like that, you should let us know ahead of time. In general, it's a good idea to list all of the medications that you take, whether they're over the counter or prescription, so that we can go over them and let you know when to start and stop certain medications before your surgery. The next piece about medications is prescriptions. Usually we will call you in a prescription for an antibiotic, either Keflex or clindamycin. Make sure you start taking that the morning before your surgery so that you get a good 3 or 4 doses of antibiotic in your system before surgery. Overall, it's to prevent infection risk, and the risk with infection in this type of surgery is low to start with, but this just helps protect you from getting any sort of infection when we're working in the scalp area. Additionally, we'll be calling in other prescriptions like prednisone, which is an anti-swelling pill. Usually we'll call in a anti-anxiety pill for your surgery, and you should bring all medications with you to your appointment. The best thing to do is have a ride to and from surgery. That way you can take adequate anti-anxiety medications and not have to go through surgery without something to help you through. Allot time off from work. Many people are now working remotely, which makes it the ideal time to do a hair transplant. But keep in mind that 1 week off of work to deal with recovery at home, to deal with swelling, and to protect those hair grafts from, the outside environment is extremely important. If you work any type of physically taxing job, then it's really important that you understand that you can't bend over or lean over, because those newly placed grafts could pop out of the scalp and then you'll lose, those precious hairs. Get yourself some supplies a couple of days before your surgery. It's a good idea to have a neck pillow, which you would, use on like an airplane. That way for the first, 3 days after surgery, you can sleep with your head upright in a comfortable position and not damage those newly placed hair grafts. I advise everyone to get Johnson & Johnson brand baby shampoo. That way you can gently cleanse the area at about day 3, and have a non-medicated shampoo that's gentle, that won't negatively affect your surgery. I also advise people to have some Neosporin, bacitracin, or some sort of triple antibiotic ointment to place on the back of the head from where we gather the grafts from the donor site. You should never use any sort of chemicals on the newly placed grafts, including the triple antibiotic ointment. And also some pads to place on your pillows or your couch. Puppy pads work great. That way, just from the back of your head, you won't stain your pillowcase. When you leave surgery, we do place a nice Telfa dressing, which is non-stick with triple antibiotic ointment, which does help protect those donor sites. It may be a good idea to download some movies on Netflix or download some games to watch over the next few days while you're recovering from surgery. That way you can relax, keep your heart rate low, and recover from surgery and not get antsy or get bored at home. And then finally, stock up on some good groceries. It's important to get good nutrition after surgery, good lean proteins, omega-3 fatty acid rich foods like salmon, avocados, things like that would be really good for after surgery. Also, make sure you get something to treat yourself, like some chocolate and some snacks, because it is a process and it's not a good time to go on a crash diet after surgery. Look forward to seeing you with us, and let us know if you like our video.